Well, this time of year, you may find yourself taking something over the counter for a cold or a flu, or maybe you've gotten something for another problem that's going on. Well, you could be risking an adverse drug reaction if you're already on heart medication. Well, joining me now is Sherry Torkos. She's a pharmacist and the co-author of Saving Women's Hearts. Good to see you.
Thanks for having me.
So what is it about heart medication and these over-the-counter drugs that people need to be aware of?
Well, I think a lot of people don't realize that the side effects with some of these medications, they can raise your blood pressure, increase your heart rate, they can interact with medications, and people often don't read the fine print that is on the packages.
Yeah, because it's there. No,
it's
it
there,
is on
but
there,
it's
right?
so hard to read. It's very small type, and I think there's an assumption that because you can buy these products over the counter without a prescription, that they're safer, and therefore you don't have to worry about it, but you do have to worry, and you should always check with your pharmacist when you're selecting products.
And pharmacists are there for that very purpose, right? It's a good idea. So what are some factors that increase the chances that you might have an adverse reaction if you go for an over-the-counter remedy?
Okay, advanced stage, so people over age 60, 65 are at greater risk of having side effects or adverse drug reactions and also interactions. If you're taking multiple medications, or if you have chronic diseases such as heart disease, diabetes, glaucoma, prostate disease, some of the ingredients in the over-the-counter drugs could interact with your health condition. Quick.
All right, so sleep aids, another thing people are always looking for.
Yes, sleep aids, and the active ingredient in most sleep aids is actually an antihistamine, either diphenhydramine or doxylamine, and that can cause dry eyes, dry nose, dry mouth. They can also interact with some medications that you take for your heart, so be cautious with them. Plus, they really are just a short-term solution. If you're having difficulty getting into a good sleep-wake cycle, melatonin can be helpful, especially for people that are a little bit older. As we get older, our melatonin levels decline in our body, so melatonin can be helpful. Also, if you're working shift work or traveling to different time zones. And I also like these supplements. They contain an amino acid called Suntheanine, and it helps to make you feel more calm, more relaxed. It helps you to get a better night's sleep, better quality sleep, without waking up the next day feeling drowsy or groggy or having any issues with your memory. So the supplements with the Suntheanine can be helpful too.
Which can happen with those. Thanks so much. Some great information.
Thanks for having
because
me.
all this stuff, I know so many people that take this stuff. I'm sure it'll lighten them for sure. Thanks again for coming in.